So, what do we want to do with Victor? Well, first off, an appropriate diagnosis would be really, really helpful, always is. With Victor Fries, the really interesting thing is I do not believe that any of his criminal behavior is motivated by mental illness. In fact, to the opposite, some of his strengths actually may tie into a different mode of mental processing and some neurological differences between him and sort of the standard population. So I'll tell you what I mean by that. I believe that we should do some further testing on Dr. Freeze, Mr. Freeze as he prefers to be called, for assessment for ADHD or possibly an autism spectrum disorder. Now, the reason for that is that he has shown, first of all, an above average intelligence and also above average creativity, which both do tend to correlate with the autistic population as well as those with ADHD. That can be a tricky correlation. It's not a stereotype because it is based off some research. However, that can be very hard for those who maybe aren't gifted in the traditional sense in that way. So, anyone you know who has those types of diagnoses, it's best not to make assumptions. But in this case, we're looking at things symptomatically. Hyper focus, what they used to call perseveration. Nowadays, they often just call it an eccentricity or in some cases an affiliation or an affinity with certain topics and things. Used to be considered a negative symptom of autism is now considered to just be a feature of the way that person may think a little bit differently than other people. And like every trait, it has strengths as well as weaknesses. So also the social difficulties and also some of the very, very, very focused thinking to the exclusion of his usual moral values. Now, his moral values are still intact, which is very interesting. He would not, he in this, at least in this iteration of the interview that I'm doing, he does not seek to harm innocent people. He does seek at times to steal money to fund his research, and he does want to kill Ferris Boyle, and he's not so hot on Batman. So those would be some exceptions, but once again, I think they're within the normal range. ADHD or autism do not explain these behaviors and the choices that he's made. Those are just personal choices. The reason I'd like to assess for that is I think it could help him have a better quality of life. That bleeds right into the treatment planning, which I think is very exciting. Going to touch on that in the next video.